the left atrium, and the left ventricle. The left ventricle has a muscular wall in order to contract to pump blood to around the body. We also have the right atrium and the right ventricle. The right ventricle has a large volume, however, its wall isn't as muscular as the left ventricle because it only needs to pump blood to the lungs. There are also 4 valves. The mitral or bicuspid valve and tricuspid valve stop blood flowing back into atria when ventricles contract. The aortic valve and pulmonary valve stop blood flowing from arteries back into the ventricles.
There are 4 major blood vessels. The vena cava are veins that return deoxygenated blood into the right atrium. The pulmonary artery takes blood to the lungs and pulmonary veins, which carry oxygenated blood from the lungs and drain it into the left atrium. The aorta, which is the biggest artery in the body, carries oxygenated blood from the left ventricle into systemic circulation. Deoxygenated blood from the body flows to the right atrium from the superior vena cava and inferior vena cava. The right atrium contracts, pumping blood to the right ventricle through the tricuspid valve.
Once the right ventricle is filled with blood, the tricuspid valve closes to prevent blood flowing back into the right atrium. Then the right ventricle contracts, forcing pulmonary valve to open as blood pumps into the pulmonary artery.
Once the left ventricle is filled with blood, the mitral valve closes. The left ventricle then contracts, forcing the aortic valve to open, allowing blood to pump to the aorta, which then pumps around the body,